This is 10-week-old Louis, and he's one of a small number of babies that suffer from a tongue tie. A tongue tie is when the membrane, called the frenulum, which holds the tongue to the floor of the mouth, grows too far forward and restricts the movement of the tongue. It can prevent a newborn baby from latching onto the breast, but if spotted early enough, a small snip is all that is needed to put it right.
Press the swab down and then give him back to you.
Okay.
If you imagine that's the tongue, sometimes, and that's the base of the mouth, sometimes it's a complete join to the tip of the tongue to the base of the mouth. Sometimes it's just 50%, sometimes it's halfway.
Because the membrane has no nerve endings in it, the procedure is almost painless.
See your tongue?
Around the country, there are increasing numbers of midwives who are qualified to do this.
There, we can see the tie there, look. Oh, I'm surprised you've managed to feed so well, actually. I think as well that you would be pleasantly surprised how easy the feeding would be if you were completely different, because his tongue would be able to move. It's quick and simple, and you'll be able to stick your tongue out your mum this afternoon, Louis, won't you? Well, basically, I just stretch the baby's mouth open, so like that. The baby's been held down. Visualise the frenulum, and then literally it's just one little snip out, and then press a swab down on the base of the tongue. I'm not like snipping into his finger, or it's not like the heel prick test where it's a needle going into skin. It's a membrane that's grown that shouldn't really be there. There's a lot of nerve endings in it. And most of the babies that cry for a few seconds. If you're making chat to you, he'll look back.
You like being swaddled, don't you?
Just quickly.
Yeah.
So obviously if the membrane's all there, then I'm literally snipping and it just stretches away. It's not a very thick membrane, and these are obviously for safety round-ended sterile scissors. Okay.
Oh dear, here we go. Louis.
It's literally stretch his mouth, little snip, press the swab down, and then give him back to you.
Okay.
There we go.
Well done. That was cool.
He's crying out because I'm pressing on it. You see, that was Bernie, that's so good. There.
What happened?
If you could, just to give him any breast milk or anything in his mouth, to help to heal, that would be brilliant.
Okay.
Turn him completely on his side, and then turn on his side a little bit.
Once Louis is put to the breast, the discomfort is forgotten quickly, and he can now latch onto the breast properly for the first time.
Smiling.
You're too busy with what's going on, aren't you?
If a tongue tie is left until the baby is older, it will be necessary for him to be given a general anaesthetic, and he would have to stay in hospital. So the key is to catch the problem when they're very young, as the procedure is so simple to do.
His cheek's nice and fat, so he's got a nice vacuum on there. Sometimes babies with tongue tie can bottle feed really well, but we know that it stops babies breastfeeding as well as they should, which is why really we're trying and catch as many babies as we can and do this simple, because it's, as you saw, it's just a little snip, and it doesn't hurt the babies. In fact, the benefits to him now is that he will find feeding so much nicer. So, and obviously you as well. It just gives you another option, really, because sadly before a lot of women would have given up because they couldn't get the baby on, just sadly. Because as we know, if the tongue can't go on and milk the breast, then the milk supply diminishes. So. Just keep bringing him in closer. Hi, Louis.
Having had a good feed, a happy Louis goes home. If you think your baby may have a tongue tie, seek qualified help as early as possible.